to see you looking so well. Are you still in Florida?
I've got 1 week left in southern heaven here, southeast Florida. A little gray today, but a little break from patient calls. So I'm standing barefoot in the grass, getting a little earthing, grounding going on, and
Good.
enjoying a little. I can't call it sunshine, but it's still nice to be outside. Yeah.
It's nice to get away. It's nice to be outside. It's nice to be able to walk barefoot.
Yeah, well, I don't know if you're a big fan of earthing and grounding. Obviously, limited science, some science, but
there's mostly in the feng shui category.
Yeah.
Professor Lin, who influenced a whole bunch of people at Stanford by putting a flagpole in the right place. But I am a founding member of BEMS, Bioelectromagnetic Society. Do you know of Lou Schlesson?
No.
Oh,
no.
There's a guy named Lou Schlesson who publishes a well-edited monthly journal on bioelectromagnetics. ELF, EMF, XYZ. It actually gets relatively simple after it gets complex.
Yeah.
And yes, this is...
There actually was I know we're supposed to talk about precision cardiology. There actually was a randomized study published yesterday of doing a 2-hour glucose tolerance test, one time after 45 minutes in front of a red light panel, and one time without the red light panel. And it's very interesting. Blood sugar rises and insulin rises were blunted by having pre-treated the subjects, volunteers, with 45 minutes of red light therapy, which is a form of electrical magnetic exposure. And some people are crazy about red light panels, and some people are skeptical, although what's his name, Michael Hamblin at Harvard, has published hundreds and hundreds of research studies.
I worked with Norm Rosenthal, who is a founder of the International Society for Light Medicine.
There you go. Yeah, and people...
Starting now, we're going to talk about personalized precision cardiology. Now, of course, you're a distinguished physician and cardiologist, but what does personalized precision cardiology mean?
Yeah, and there's two terms there. Personalized means you're getting an evaluation to try and identify what could be pushing you down the road to atherosclerosis and events like heart attack, stroke. So how are you different from your brothers, your sisters, your neighbors, your coworkers, all the other patients sitting in the waiting room? And precision means, can we really nail this testing and measurement and risk prediction down? And just to quickly, for sake of efficiency, even if a person goes to their doctor, as I had my first patient this morning at 9 a.m., my father had a heart attack and died at age 60. I want to evaluate my risk. Usually they're using something called a Framingham Risk Score Calculator, or the American Heart Association Risk Score Calculator. You put in your age and your blood pressure and your blood sugar and your blood cholesterol and maybe one or two other factors, and it predicts you over the next 10 years your risk of having a heart attack. It could be very high, could be very low. That's the standard of care right now, and many doctors don't even do that calculation, but that's the standard of care. But all that was derived from populations. And all we know is if we have a room of 1,000 people that are judged to be low risk and 1,000 people judged to be high risk, there will be a difference over 10 years, and the people in the room that are judged to be high risk will have more events. But you don't care so much about the other people. You care about you. So precision means, can we nail it down? And as you and I have talked on other Instagram Lives and in other formats, the role of advanced lab testing is mandatory. And let's not beat that down, but the homocysteines and the C-reactive proteins and the hemoglobin A1Cs and measures of oxidative stress and inflammation.
If stress will harm you, and cholesterol as an innocent bystander, I think we paid too much attention to the Framingham Heart Study, which was at Boston University. So I learned early on about it.
Right. But and I know you famously, you say that 92% of disease is lifestyle and 8% is genetics.
Right.
In cardiovascular disease, it might be a little bit more than 8%. And again, precision medicine. We can do little cheek swabs now and get pretty advanced cholesterol gene profiles, what are called genetic risk scores, GRS, that are, personalized. They're your genes, and what do they predict? But really, precision medicine now, and a lot of people will run away. We can't really use echocardiography for the heart to see the arteries, because the arteries are small, the heart's moving, and the arteries are very serpiginous. We can't.
He froze.
Is CT scanning, and that's already going to get some people running away because it's radiation. But starting in 1990, we got a simple test for personalized precision evaluation called a heart calcium CT scan. And in about 10 seconds of holding your breath, you can find out if your arteries have no calcification, which would be ideal, mild, moderate, or severe. And there's a number called the Agatston score, the coronary artery calcium score. And that's already a huge advance over the Framingham risk calculator, because you can have high calculator risk and come out of zero and actually be in pretty good shape. And even maybe scarier, you could be calculated to be low risk, but still be walking around. Maybe nobody checked your lipoprotein little a, and you've got a big genetic input on your arteries. I see it all the time. So for about $75, anybody can go to their local hospital with a prescription from their doctor. That's often an obstacle. And in about 5 seconds, hold their breath and get a very low dose radiation coronary artery calcium CT scan. But just to finish this in one more breath, now since 2021, there's an even more advanced precision personalized test called a coronary CT angiogram with artificial intelligence evaluation. It's a little more complicated, but they do put in an IV. They give iodine dye, makes you feel hot for 20 seconds. You get a Band-Aid and you go home. It has to be done a little bit more intricate, but it's a very simple test done in almost all hospitals. Some patients actually pay for it out of pocket. In my local community, it's about $700 to $800. But you can actually see the coronary arteries. You can see what's called soft plaque, hard plaque, low density, high risk plaque, and you can measure with AI technology. And this is widely available. I am not an investor in a company called clearlyhealth.com, CLEERLY health.com, but they are the pioneers in this area, all based on very impressive published science. So it's not speculation. But I can talk to one patient, tell them exactly how much plaque, what kind of plaque, what risk the plaque is. We can implement a plan, and we can come back in a year and see if our plan worked, if we shrunk. So this is a revolution that for some people they'll want to take part in. There's still a cost issue because this isn't routinely covered by insurance, but we're not talking $10,000 or $15,000. With $1,000 in your pocket, if you wonder what's going on in your heart, you can have the same detailed analysis that Elon Musk, gets, because it's great stuff, precise stuff. That's what I did this morning with a whole bunch of patients. Yeah.
So let's talk a little bit about oxidized fats and harm, and let's talk a little bit about antioxidants sufficient to prevent oxidized fats from becoming what first are called the vulnerable plaque.
Right. And as a pioneer in lab testing, and as what a auto consultant of world fame Edward Deming said, you can't change what you can't measure. So the word oxidative stress is not going to come up in most visits with a healthcare provider, because it's sort of felt there's no way to test for it and it can't be important. But there's a urine test. You use the oxyguanine.
Yes, adoxoguanine.
Yeah.
It's a urine test, non-invasive, inexpensive, and it tells you whether DNA is being oxidized and damaged or being produced.
And there is another urine test, inexpensive, called F2 isoprostanes that also is a measure of oxidative stress. And then you can measure blood oxidized LDL, pretty inexpensive.
Directly oxidized LDL or oxidized cholesterol directly, not the antibodies that form because of those damaged fats. But this can now become part of our routine, and we would urge people to know this information.
And I agree. And so if you can measure it, and I am surprised because I do measure the urine to be providing a lot of dietary antioxidants, brightly colored fruits and vegetables from close to nature sources, not popsicles and Skittles. And yet they seem to still be at an oxidative deficit. And they need to look to antioxidants like the proper form of vitamin C. Certainly has lots of data to try and restore a balance there in oxidative stress and distress. And, so I'm a big fan of vitamin C for heart disease patients, as I know you are.
Yes.
Whether that's,
Into turn challenge into opportunity.
Yeah, whether that's, actually making our collagen more healthy and kind of with the Linus Pauling theory of preventing coronary disease with vitamin C and lysine, which has been studied a bit in animal models, and we can always use a bit more human data or not. But yeah, being aware that, we can now measure this precision, personalized cardiology risk and disease burden, but then we got to have strategies to deal with it, and lifestyle first, because that's 92% of the picture in Dr. Russell Jaffe's esteemed estimation. But, measuring, my lab panels are crazy extensive because I want to try and restore it to balance most every parameter we can measure, whether it's omega-3 deficits or other vitamin deficits or inflammation excesses or certainly sugar and insulin resistance situations. And it's not easy. It's a complex program, but it's really root cause, correction.
Root cause correction. Let's get to the cause of the person's individual risk profile and then know what to do with lifestyle and other therapies. But start with what you eat and drink, think and do. Your food can be your medicine can be your food much of the time.
Yeah. And a lot of my patients just lately are coming to me asking, what's this all about methylation? Because there happens to be an online, very popular business individual by the name of Gary Brecka. He's a very large audience, bigger than your audience, my audience. And he's kind of like merged into a health guru, kind of like Tony Robbins did the same thing from a business background. And he's selling a cheek swab panel that's a very detailed methylation panel, of course.
Well, he's focusing on MTHFR, which is completely misunderstood according to the geneticists, including people who actually did the sequencing at MIT. What you want to know is the relationship of homocysteine to methionine. You want homocysteine to be relatively low. 6 is the ideal if you want to live long and well, and methionine should be high, because what is happening today, using an artificial form of B12, we are hypermethylating people. And that is just right is just right. As you were saying, it's kind of the Goldilocks scenario. Just right is just right. Too much is too much, and too little is too little. So I have a respectful correction for those who are on the MTHFR misunderstanding bandwagon.
Right, yeah. Because he's been, and again, he's reaching so many people that they're coming to my office with these fairly complex methylation genetic results. But he's been talking mainly about TMG, trimethylglycine, which certainly can enhance the lowering of homocysteine and the raising of methionine, but it's not enough.
We included TMG in 1987 in our super multivitamin and have continued to have it ever since. So yes, trimethylglycine is a balancing agent important in the methylation pathways, and you can get lost in the weeds, as biochemists sometimes do, trying to tease apart which aspect of methylation may or may not for an individual be dysfunctional.
Right. Interesting. So that is my update on precision personalized cardiology. That the Framingham or the American Heart Risk Calculator works for 1,000 people, but you really care about one person when you're seeing a cardiologist. That's your health. And you should ask for advanced labs. Actually, now you can order crazy advanced panels of labs cash for reasonably low prices from some of the online labs, lifeextension.com, lifeforce.com, and functionhealth.com. If your doctor won't let you get these labs, which is a shame, or they're not familiar with how to order them, you can get most of them self-paid for a few $100s. Now, we talked about calcium score CT scans at a very low dose radiation in a more advanced coronary CT angiogram with AI interpretation. But we could radically, precisely change the course of many people's lives by the power of information. And then we have to apply everything else to change the course of their next 10, 20 years.
Yes, we can save 1 million lives a year. We can use $1 trillion that we currently spend to bury people early, to speed the transition to prevention. And we could add $8 trillion to the national wealth of this country by saving 1 million lives. Right. You're doing that in practice. You're showing that this is not a hypothetical. This is a real opportunity to be well and happy. So thank you so much for being.
Thank you. Have a wonderful day. I look forward to sharing this with my community. You're brilliant, man.
Thanks much yourself.
Bye-bye.